Welcome to another episode of Breaking the Silence, the conversations. People are stepping forward thick and fast to speak out, whistleblow, mainly after they've left. And today, there's no there's a similar situation. We've got with us today Ruth McAuley, who is from New Zealand originally. She worked for 3 years in Christchurch after qualifying as a radiographer. And for some strange reason, she then decided to come across to the UK to practice and has been on a kind of whistle-stop tour of the country, working in trusts such as Southampton, my old stamping ground, Wolverhampton, Newcastle, even down here in Cornwall. And most of her career latterly in the Liverpool area. So her story is that, like I say, she's an ex-radiographer, and we'll come to how it's become ex through the story. But firstly, thank you for joining us, Ruth, on this conversation, as we call it. It's very relaxed.
Yeah, thank you, David. Yeah, thanks so much for having me.
So one of the interesting aspects of this, and you'll see there's a sort of two-pronged reason for this interview. Number one is that you've obviously experienced the COVID pandemic, both as a radiographer and also as a patient, as we'll come to discuss, and a vaccine injured. And the second aspect, you've also dared to tread the boards of becoming an NHS whistleblower and have felt the full wrath of the NHS gods for doing so. So I think if we start, Ruth, really with your experience of, before we come to your particular vaccine injury, what was your experience with the pandemic? What headlines would you say for people who don't work within the NHS? Was it as bad as the BBC made out, or what was your personal experience as a radiographer?
I didn't actually work. I wasn't working during the pandemic because I got suspended in February 2019, and then so they kept me on this never-ending suspension and then I ultimately resigned in February 2020. So I didn't actually work during the
You were blessed to not be worked, so you're actually a blessing to be suspended through the whole sort of period, really. What were your general impressions then as a member of the public watching this thing, the fear, the psyops, the propaganda? Were you convinced at any point that there was something going on? Or?
No, I thought it made me really, really angry when they were doing their TikTok dances. Um, I knew it was just a scam. I mean, I wasn't fully awake, and I only became sort of fully awake when I had my vaccine injury. Um, so there were, I think there's always an element of, maybe there are really sick people, but there's, I knew what the NHS is like.
So it's just a gut instinct, is what you're saying, that something didn't feel right about the sort of morbidity, mortality associated with COVID.
Yeah.
But then came this this life-saving tincture that they offered in the form of a jab. Take me through that, Ruth. What was your thinking for going for the jab? Was it to do with work, the mandate, or was it a genuine fear of COVID?
Yeah, just trying to think back. I think I did get swept up in the fear. And there was propaganda about the vaccines, and it was a constant bombardment. I'm medical, and even I was swept into it. I didn't want to be seen as a, conspiracy theorist. That's how bad to me, looking back, how bad the propaganda was. So I had it. I went, and I feel ashamed now. I feel ashamed looking back that I did that.
Were you told much about it? Obviously, you're presenting for your first jab. I mean, how many did you have in the end?
I had three. So I had the two AstraZeneca, um, and I think part of it was that my parents. So my parents are elderly, um, and I wanted to have the vaccine in case I needed to get back to New Zealand in case they got ill. Because Jacinda Ardern had mandated the vaccine. I used to think that Jacinda Ardern was like amazing, that I wanted her to be my mum. She was so caring. Now I just think that she needs to be imprisoned.
Mm.
Um, and so I had the vaccine because I thought, well, in case I need to get out to New Zealand in a hurry, at least I've had the jabs, and I can get over there, and I'll be okay. So I had the 2 AstraZeneca in May and June in 2021, and then in February 2022, I had the Pfizer vaccine, and I got my dog, Forrest. He's a rescue, and so he was jumping all over me. I was sleeping on the couch because he was having diarrhea every 2 hours, and so I thought the bruises that I was getting were from him jumping up on me, and I had bleeding gums, and I just thought that I hadn't flossed my teeth enough. I was I was tired. I was just so exhausted. I couldn't put one foot in front of another. It was just, and
And
I just thought,
was this after your Pfizer? So you were okay after the Zenecas?
yeah. I mean, I had the initial headache, feeling rotten after the AstraZeneca, but I think it kind of set up this primed my system. I think those 2 AstraZeneca ones.
Again, just I mean, looking at the combination, I've always sort of laboured this point. 2 AstraZenecas and a Pfizer. If anyone can show me the trial data where they mix and match, it's bad enough the original trial data from each company, but when you're mixing and matching, there's no audit trail. Who do you blame? And like you say, there's all sorts of immunological mechanisms here at play. Where, like you mentioned, AstraZeneca, we know there's the links to the platelet issues and vaccine related thromboses, and then Pfizer comes in and causes another array of autoimmune concerns, and you're good to go with what turned out to be. I'll let you tell the viewers really what happened.
Yeah. So I had this bleeding gums, this bruising, this fatigue, and so I was just putting those down to other things, and then I ended up with a bleeding nose. So just slowly dripping blood, all day.
This is a new thing.
And
This isn't something you've had in the past.
no, nothing like, not, this is, I've got blood results, and that I've got medical records where my platelet levels are normal. So
What was the time frame here between the jab going in your arm and then the development of
so,
hematological red flags?
so yeah, so the 6th of February, and then I started to have February, started to feeling, obviously having these symptoms, but not knowing, because no one had warned me. No one had said, if you have these symptoms of bleeding gums, bruising, fatigue, you can put those things down to other things.
But incidentally, what were you told? Like at each vaccine injection that you had, were you told anything? What was your experience as a consumer or a patient, as it were, of the jab? Were you given any info at all, or just?
So the Pfizer one, there was a sheet about, I think there was a bit about myocarditis. AstraZeneca, nothing.
Were you given a sheet before you had the jab or after you had the jab? After.
After, yeah.
So if you change your mind based on what's on that leaflet, it's a bit late at that point, isn't it? And I hear this reported a lot, that you're given the info leaflet after, and the jab's already circulating at that point. So just poor practice, isn't it? Just generally, you don't have to be a rocket scientist to realise. But anything about Zeneca? Was it just roll your sleeve up in your arm, see you later?
Yeah. So all of them were just, in our no information before. And I'm medical. I've been a radiographer since I started my training when I was 18. I'm now 49. I was 40, whatever I was, 47. I've never heard of immune thrombocytopenia. Never even heard of it. Didn't know what it was. If you said to me, "Hey Ruth, what's the symptoms for immune thrombocytopenia?" I'd be, "What? Never heard of it." So obviously, then I had these pinpoint, the purple petechia bruising. I did know that at that point that was something serious, because my mum had sepsis in New Zealand. She had a 10 centimetre liver abscess, and she had sepsis as part of that. I knew I'd done online sepsis training. I knew the symptoms, so I knew that was serious. So I contacted my GP. So the timeline was 6th of February. By the time I got a GP appointment, because it was difficult to even get an appointment, it was early April at this point. So it was a couple of months. So the time frame was quite short. By the time, because I obviously didn't know what the symptoms were, and so my GP did blood test, and she rang. So I got rung at about 11 o'clock at night the next day by the on-call doctor, and they said your platelets are 5. You need to go to Salford Royal, the emergency assessment unit, ASAP. The next day, couldn't sleep, thought I was going to have a massive hemorrhage and die
just
in my
for
sleep.
people who don't know, I mean, a 5 is critical. I mean, if anything in double figures is bad enough. Platelets, for anyone who don't know, they're kind of the sticky bits in the blood. So if you do cut yourself, it's what causes the clot to form and to stop bleeding. So if you've got a lack of them, you've obviously got that increased hemorrhage bleeding risk. And at 5, that is ultra critical. So you're getting this 11 o'clock to go in would have been for a platelet transfusion, I presume.
So the interesting thing that I found out a year later when I asked for my medical records was that my GP, the one that asked for the blood test, she tried to cover up. So I was gobsmacked when I read this. It knocked me for six. So when I'd had the blood test, they do what's called a blood microscopy. They put your blood on a under a microscope, and the lab people had said thrombocytopenia, likely ITP, some platelet aggregates seen, which is like platelets clumping together. Then my GP wrote on it normal. So she, even though the hospital was saying thrombocytopenia, my GP is saying normal.
Has that ever been acknowledged as a mistake? I mean, I've been that doctor when you've got thousands of results to go through. I mean, it's a pretty big miss, respectfully to the GP, but has that ever been acknowledged as an error that was made, or is it, do you think it was a cover-up?
Well, so it wasn't just a one-off. So as my it's called as a one that's called an APTT, one of the clotting times. So my clotting, the time that my blood was taking to clot was shorter, so it was clotting faster than normal. And my D-dimer for my age was slightly elevated as well. It was only 4 above normal. So there were signs there. To me, you've got my blood's clotting slightly, my blood is clotting faster than normal. There's signs of potentially, that I'm heading for a clot, and my platelets were extremely low. There were 3 things, and she said normal on all of those. So it wasn't just that it was like she's tired and she's made an error. And then on top of that, she rang me 3 days later. 3 days later, at this point, I was already in the hospital. I was in the hematology unit. And she said, she rang, I'm just ringing to see if you're okay. I'm like, well, I'm in the hematology unit. So the reason the on-call doctor, so my GP had seen those results at 8 o'clock at night, said that they were normal, satisfactory, didn't do anything about it. And then the on-call doctor read the results at 10:30 at night and then rang me and said, you need to go to the hospital. So got admitted to emergency assessment unit and then the hematology ward. And no one acknowledged that it was from the vaccine. They just, what I've had is you get this what I call a grey rocking, where you mention the vaccine and they just go into this kind of stony face look where they just won't even acknowledge it, won't talk about it. Um, and it's soul destroying. It's so soul destroying because, imagine being treated that way if you've got cancer. If you say to someone that you've got cancer and you get no acknowledgement, you get no one says sorry, no one says anything. They just say nothing. It's not normal. It's just really not normal. It's not a normal response, and um, it's kind of like cognitive dissonance, I suppose, that these people are just disconnecting from
They must be
from.
seeing it though, Ruth. They must have been seeing it because it was one of the reasons Seneca got booted. Lots of autoimmune thrombocytopenias. I've seen blood films myself with my own eyes in live blood analyses where the red blood cells of people who've been vaccinated are just not in good condition. They've got disheveled poikilocytosis and clumping and rouleau formation, which are just unusual to see. And they must be seeing that because they're hematologists. So, like you say, it's
Yeah.
funny that you sort of picked up the immediate vibe that you'd obviously got an inkling that it was a vaccine.
Mm,
And there was never any lead up to that other than your own gut instinct. You've had the vaccine and then these symptoms have progressed since.
yeah.
So you've not walked in
Yeah.
there as an anti-vaxxer, but as soon as you have the question asked, you get that immediate lockstep, stone
Mm,
face reaction
yeah.
and defensiveness, and it's very strange and cognitive dissonance, as you mentioned. So what's
Mm.
your sort of journey been on as a VIT? Have they formally called it vaccine-induced thrombocytopenia? There's been
But
some obstruction.
yeah, so I think what I've kind of struggled with is that the AstraZeneca, they've clearly said it's vaccine-induced thrombotic um, thrombocytopenia. So they've clearly said that it causes um, clots and low platelets. Mine is slightly different because mine is my immune system is attacking and destroying my platelets. It's not that I had a blood clot in my platelets, it's that I've got this chronic, ongoing low platelets, and it is very, very severe. So this vaccine induced immune thrombocytopenia is, so if I don't have medication, if I don't have this weekly injection of, it's called romiplastin, my platelets are 0, 1, 2. So I'm literally, I feel like a ball and chain connected to the NHS, that the one institution that has caused me so much, pain and trauma over and now I'm stuck. I'm stuck having to go there week after week
Almost
after
like
week.
dialysis, isn't it, in a way, because you've got to be
Yeah.
hooked up to that machine. So, like you say, ball and chain, really. And as we'll come to in the latter part of the interview, it's almost like a
Mm.
Stockholm syndrome, having to go back to the institution that's been abusive to you for what we'll talk
Yeah,
about.
totally.
So, in summary, kind of how are you doing? What's been are these injections helping maintain your platelets? Have you had any
Um,
bleeds or anything, or have you managed to avoid?
no, I've not had any like major bleeds or anything. Apart from the normal, like massive but blood blisters in my mouth, and but it's been very up and down and erratic. It's really this, I think, with immune thrombocytopenia, if it's not from a vaccine, I think they can kind of, some people can, it's can be on, regular medication, but this seems to be that it's a
Like a
very,
constant attack on your platelets?
yeah, my consultant described my condition as very brittle. So it will just, so I didn't respond to steroids. I didn't respond to IVIG. I took 6 months to respond to rituximab, and I didn't have a lasting response to that because, do you know what? I got COVID.
Mhm.
And so I lost my response to that. And then I was doing okay. I was on a medication called eltrombopag, And then I lost my response to that. It's called refracting. So I refracted to a trumpet pack, and then my consultant was saying, right, if this drug that we're going to put you on, romiflostin, if this doesn't work, we're going to take your spleen out, which I thought, no, I don't want that. So they've been persisting with this drug called romiflostin, which is, I don't think it's personally safe for me, because it's been shooting my platelet levels up to 600, 800, 1,080. And they won't table any other options. This is the thing, I think to find a solution to something, you need to realize that there's a problem, and they won't realize that there's a problem to start with. If they realized and said that this vaccine has caused these injuries, then we can do research into it and we can try and find a solution. But they're not doing that. They are not saying, like, the vaccine has caused this. And so they're ploughing down the same path, and it's the definition of stupidity, isn't it? If you keep making the same mistakes over and over again and expecting a different result, then it's just stupidity.
And there's been literally no acknowledgement, not even quiet, unofficial. This could have been the vaccine kind of comments made by nurses, doctors, or has it just been a plain gaslighting? It's just one of those things.
A couple of registrars have sort of acknowledged it, not directly. They say vaccines can cause this condition, but they haven't come out right and said that vaccine caused your injury. Yes, I agree with you. One pharmacist, clinical pharmacist, he did agree with me. He said, yes, it is connected, but they never put it on record.
Did you ever meet any other patients in the clinic where you're having your injections? Did you ever meet any fellow VIT sufferers or people in the vaccine injury communities that have got similar stories?
I mean, there's like Facebook groups. So there's a part of the UK CVI Facebook group. We can't use the words Pfizer, vaccine, AstraZeneca. If we do, that group gets shut down. So Facebook is censored. It's censored. So we cannot use. We have to use other words. So that the group.
I see them put like carrots and things that you have to. But it sums up, doesn't it, mate? That you can't in a focus group of vaccine injured people, a community as it were, you can't say certain words because Meta have pre-censored it really, and there was a lot of pre-reactions to things like algorithmic issues around social media that if Dave Cartland says Pfizer, he's shut down. But how do you feel before we move on to your sort of experience of whistleblowing, how do you feel about having your vaccine? Is it a big regret? And how do you feel about the people that jabbed you? Those three, I presume there were three different individuals. What would you like to say to them?
Yeah. I've got mixed feelings about my decision to have the vaccine, because it's a massive regret. I feel stupid. I feel stupid that I got sucked into the propaganda. But angry as well, because I wasn't warned. And yeah, the girl that gave me the Pfizer one, like I watched John Campbell, and he was saying that they should aspirate so then they know that they're not injecting into a vessel. And I asked her to do that. She didn't know what that was. She just said, "Oh, you'd end up with an air pocket in your arm." She didn't know.
It's basic level stuff. And the problem was they were letting every man and his dog have a crack at being a vaccinator. So, you'd often be greeted by volunteers who've done a computer module for 1 hour. It's basic, stick an injection into the deltoid. There's a very small area that you should be aiming for. And you aspirate to check there's no blood in the chamber, because then it becomes an intravascular injection. And there is a risk of air emboli. So they've even got that wrong. If you're in a vessel, that's when you put an air embolus into the blood vessel and it can cause trouble. So by not aspirating, they're increasing. So they're giving you duff advice there as well. And then I've seen various incarnations of vaccination injection sites all the way down to the sort of back of the tricep, all the way up to the almost carotid. And so people just didn't know their anatomy, and it's been awful to watch. But how are you now? Are you getting back to health? Are you feeling? I mean, obviously, we're going to come into a very stressful episode of your life now, but how are you doing physically from the fit?
Yeah, I mean, it's some days are better than others. I think the hardest part is coming to terms with what's happened, and I don't think I'm not there yet. I think I still wake up thinking, I'm going to wake up and I'm going to be back to normal. I'm still in this, I think, this shock mode, that disbelief that hasn't happened to me. And I think, yeah,
Is this going to be a lifelong thing? Have they said it's going to be a lifelong back and forth?
yeah,
It's not for
yeah.
cure.
So the one thing that, I had the vaccine so that I could go back to New Zealand, and now it's actually stopping me from going back there, because the drug that I'm on, it's not funded in New Zealand. So the one thing that I did to protect others and do the right thing by everybody else has actually ended up harming me and stopped me from living the life that I want to live. So I want to go back to New Zealand. I want to see my family, but I can't do that, because I couldn't just get on a plane and go back to New Zealand, because this drug that I'm on, I have to have weekly injections, and I need a blood test. So I need a blood test every week to check my levels and then have this injection. So I can't just, I need to apply to the government in New Zealand to say, can you fund this drug? Because, I can't without it. I'm potentially going
How
to
much
have.
does it cost, Ruth? What's the cost of the treatment? Do you know?
I don't know, but it's in the thousands and thousands and thousands. So
Are you in the UK alone, or are you? Do you get family to come and visit the other way? Come from New Zealand to see you?
um,
It's a long
so
way. I've done it myself. It's
yeah,
literally the other
yeah.
side.
So my mum and dad are in the 80s, so they're very they just like their little routine, going to the same places, and they came over for my sister's wedding. My sister is here, but I don't see that much of her. But yeah, New Zealand is, it's where I want to be, but I just feel that, I can't just pick up and head over there because of this condition.
Just an awful thing. You've done it for the right reasons. Again, most of the people that I've had feedback from for having the vaccine was exactly the reason you mentioned. I've heard people shriek as they've left the room saying, "Oh, I can do that holiday now. I can go and see a relative, or I've got that international job now." It was never a fear of the genuine illness at hand here. It was always a a coercion for travel or for work. And I don't know how the profession lived with themselves. You're one story, but one of many, many, many. Unfortunately, the NHS are suffering from a condition that I call the ostrich syndrome, where we talked about it in your reactions to suggesting the heinous accusation of it being to do with the vaccine. But we're 2025 now, and still people will blame it on absolutely everything from, I mean, when you see the ridiculous headlines in the UK about what's causing these upticks in cancer and clots and all the rest of it, and everything but the elephant stomping through the room. So the ostrich syndrome really is clever in terms of the psyops that have been engaged with to cause this. Ruth, it's clearly left a scar with you, and I'm just sorry, but on behalf of the profession that I used to represent, it's just sickening.
Yeah, I think actually there was a woman that I know from the park. Her name's Pat, because obviously I spend a lot of time in my local park with my dog, and this is talking about other people with the same condition, and I'd seen that she'd had these bruises on her legs, like quite severe bruises just below her knees. And I said to her, "Have you had a fall?" And she said, "No, no." She said, "You only have to look at me and a bruise." And I said, "Oh, you're on blood thinners." "No, no." I said, told her about me, so I told her about my condition. I said, the only reason I'm saying is because, this is what's happened to me. And I said, "Have you had the vaccine by any chance?" And she said, "Yeah, but that was 2 years ago." So I explained about the side effects, what this condition does. I said to her, go to your GP just to be on the safe side. So she did. Next time I saw her platelets were 4. So she'd just been walking around the park for 2 years with platelet levels. And so she paid privately. She went to see a hematologist. She walked in and went, "I know it's from the vaccine." And he laughed at her. And then she said, "Have you had the vaccine?" And then he laughed. And then he said, "No." So
So much psychology in that there, isn't there, in what you just said there? Firstly, you're giving her the first this woman's heard of it is in a park with the dogs walking and a mutual conversation by complete chance. And then you've got this doctor who, and 80% of the NHS, give or take, stopped after 2. A lot of people didn't have it. The NHS 100K for a start. There were a group of doctors and nurses and healthcare that didn't want it. But so there's the public have to read between the lines there and say, why did these people stop after 2? 80% across the board, and why did 100,000 NHS staff not want it? There's a damning conclusion to that if they care to think about it. But I think you mentioned earlier again about a lady that you knew from a group that was pregnant. Do you want to share that story? Or?
Yeah, so she's lives down the road from me, and I'm not seen her for ages. And so I saw her, and she said that she was pregnant, and I knew that she'd had some relationship problems and separated from her husband. And so I was, really pleased for her because, she's like pregnant. It's an exciting time. And I'd not seen her for a while. I messaged her on Messenger, and she said that she'd had the scan. Actually, when I was speaking to her, when I was on the way to the park, she said, I told her about what had happened to me. And I said, that indirectly, I didn't say it outright, but I was saying, that the vaccine, what had happened to me. And then she said that she just had her vaccine. So she was just had her, I'm not sure if it was the first or second scan, but she was about sort of 18 weeks. She just had the vaccine, and that immediately set alarm bells off in my head. And so about sort of 4 weeks later, I contacted her because of her saying about the vaccine. And I said, "I'm just checking in on you." And she said that she'd had to terminate her baby because when she'd had the scan, the baby had a lot of fluid around its brain, and they were saying it was Down syndrome, and that she had to terminate the baby. And I just think, I just wouldn't ever tell a pregnant woman to have their COVID jab. I don't know who in their right mind medically could tell a pregnant woman to have the COVID vaccine. It's just, and especially Pfizer. To me, it's just gene therapy. It's not safe.
That was children as well. They gave it to children down to 5. They gave it to breastfeeding mums. My own wife rang up the GP surgery and didn't believe me at the time and asked one of the GPs, "Is it okay in breastfeeding?" And again, the answer was absolutely yes. And now the point I always made with pregnancy was the claims that were being made were premature and exaggerated, saying that the vaccine was safe long term when pregnant women, as we discussed off camera, hadn't been part of any of the trials. And secondly, that small number that did had a horrible time, and lots of them lost their babies in terms of the percentage reported fetal outcomes, as well as a quarter pretty much had severe adverse events. And then, despite having that information logged and loaded in the Pfizer documents, then a consultant obstetrician would tell a pregnant woman to have jabs and it's safe. It's like you say, who in their right mind would? I mean, if you read the BNF for any drug, any drug. It warns against, even if it's paracetamol, it will say, we've never tested paracetamol on pregnant women, but we presume it's safe because people take paracetamol during pregnancy. And the same for there's a lot of fence sitting with the BNF, and it says, we don't necessarily know of any problems, but it's unethical to test on pregnant women. And that was the same with Pfizer. They excluded, and Moderna excluded, and AstraZeneca excluded. But to then proceed to jab in the obstetric clinic and really did a job on pregnant moms. I've never come across a pregnant woman that was ill from COVID. I've never come across a child in my personal clinical practice that was sick from COVID, other than a snotty nose, and that's it. So there's all risk and no reward in those two particular cohorts, which really was the sort of linchpin for my speaking out, because they were going down the ages, they were going for people with no comorbidities, and we were seeing that people that allegedly died were obese and had multiple comorbidities. So it was these cohorts that just didn't need it. It was all risk and no reward, as mentioned. So
as well, this makes me really angry as well, is that my son, so he's 19, he'll be 20 in May. So just trying to think, when he had the vaccine, I wasn't told. He went and had the vaccine, and I don't know where, still to this day, I don't know where he had it. But he had it when he was 17. So he wasn't even 18 at that point. He had the vaccine. And I didn't want him to have it. And yet he went and had it. And that's just, I don't know who in their right mind would inject a teenager and not ask, where is she, are your parents okay with you having this?
And there was a big push, wasn't there? I remember it myself, and I remember it specifically because I left my job in general practice because the surgery had shared with me that they weren't having their own kids vaccinated, but were going down and vaccinating your kids. And that didn't sit right with me at all. It was completely abhorrent, ethically speaking. But there was a big push for the 12 to 17-year-old category, quite, in lockstep across the world. And, they were turning up at schools, they were turning up at universities, offering a pizza for free, or a burger for free, or a cinema ticket for free. Lots of coercion. Some of the crazy things they used to offer people to have the vaccine were just completely unethical. Like you say, you got a 17-year-old. Did they assess their Gillick competence? Because my experience of the vaccine clinic is roll your sleeve up, it's in your arm, see you later. With no exchange of information, let alone assessment of capacity and competence. So, and this went all the way down. They were going to giving it to 12-year-olds. I know cases where parents said no, and then the teachers still allowed the nurse to give the COVID jab. Loads of cases of that. I mean, what on earth is going on in the ethical compasses of these people pressing that syringe? I don't know the answer to that. But Ruth, I'm keen to sort of move on to the other half of your story, which is pretty damning, to be honest. So both me and you have got one thing in common. We are rebel rousers, we're troublemakers, all in the name of patient safety and evidence-based medicine and ethics. Tell us your story, Ruth. I'm going to probably not interject much because take us right back to the beginning. Obviously, you've worked in a lot of places in the UK. When did you, I think it all started from you just reporting things that you're duty bound to report in certain clinical arenas, clinical practices, and that set off, that whistleblow set off a chain reaction that we're going to hear the story now. So sorry to traumatize you going through it.
So I worked in Liverpool for Liverpool Community Health, and then we were GP transferred to the Royal Liverpool and Broad Green Hospital. So I'd worked there from 2013, but beginning of 2013, and then the problem started in the end of 2017, just as we 2P transferred. So, people don't leave jobs, they leave managers. So it's often, so we had a new manager when we 2P transferred. My immediate manager, I liked, she was okay, it was the next manager up. And I worked in the community, and it was X-ray bloods physio, and then worked at another centre, South Liverpool Treatment Centre. most of the people that I worked with were they were waspy women. So they were, as every year went that they got to their retirement, that then the goalposts kept changing. And so these were older women. They all knew each other. They all trained together. But one of them, she had problems with alcohol, and so I'd noticed that she was just getting worse. Her parents was kind of getting worse, and there was one instance where I had to intervene to stop her over irradiating a patient, and I'd sort of had enough. Like, I'd kept quiet about it. We all kept quiet about it. We all just didn't say anything, and I'd had enough at this point. And so I spoke up to my manager, and my manager said, well, it's not affecting her work, so she wasn't going to do anything about it. But then she went and bitched about me, or mentioned some comments to this new manager. And so that was the kind of trigger point, was that kind of, but I was doing datexes as well. So I'm from New Zealand. I'm quite my parents are my dad was an electrician. So my mum was a trained nurse. She stay at home mum, and my dad was an electrician. But he did up our house, and would fix everything. And so I grew up being that kind of, if something's wrong, then you can just fix it. This kind of system approach, kind of, that's the way that I see things. That, if something's not right, well, you can kind of look at stuff and see how can you fix it and how can you make it better. Sorry. And so I did datexes, with the kind of thought that, well, if I do this datex, then things will they might improve these things, but that isn't what happens with datexes.
Yeah, just for people who don't know, datexes are the hospital system that, they're deliberately difficult, a bit like the yellow card reporting system, and it's a bit of a difficult task, isn't it? You're busy doing other things, and to sit at the computer and fill in this endless form of stuff. But it's the hospital reporting system for anything, really, anything from clinical care to anything. But would you say most of your datexes were around clinical care, patient safety?
Yeah, so one of them was a guy he was a prison patient, and he had, so this is where it's fragmentation of the NHS, where you've got different providers. So in the NHS, they have private providers that provide the care, but it causes this fragmentation of the care. So this patient he was a prison patient. He'd had his hand x-rayed through InHealth, and he didn't get the outcome of his x-ray. So he had a fracture in his hand that was malunion. So the bones hadn't healed back together. They did nothing. He wasn't seen by an orthopedic surgeon. He wasn't referred to anywhere, because the Royal Liverpool Hospital had done this virtual fracture clinic. Well, that's fine. That's great. You're going to save all this time with all these, only have the urgent cases go in to actually see the doctor. But if you're a prison patient, where's your mobile phone? You don't have a mobile phone, do you? If you're in prison, you're relying on the staff and the prison service. So this guy just fell through the net. So I tried to do a datex about it, thinking that, they might improve these systems. But I got told off for it. I got told, you're not party to his notes, you don't know anything about it. So just just don't
It's a
complete.
bit like safeguarding concerns. I've worked in safeguarding. You don't necessarily have had to read the notes. A gut instinct between an interaction, it can be enough, because what you're trying to do is that level of, auditing these things, like you say, find the solution, identify that the problem needs to be made first before you find a solution. So that's a really fair data, I would say, even just from what you told me, that a result has slipped through the net and it flagged up, the same as the alcohol problem lady that you mentioned. These are fair data. Would you say there's similar sort of cases, but then obviously you're then being labelled as a pathological datex completer?
So I then did one of the other concerns that I raised was that, so we were obviously in the community, but on the odd occasion we'd get quite poorly patients, and so we'd get patients that had pneumonia or that needed referring on to the acute hospital, or occasionally we'd have patients with like a pneumothorax, which is perforated lung. So there were instances where we needed urgent reports, and we used to have the system where we would just ring up. We'd ring up the hot reporting, and they would answer the phone. We'd say, "Could you get an urgent done on this, please?" Yep. Print out the sticker, go and physically find the radiologist. Then, and unbeknownst to me, I didn't know this, but then the radiologist started working from home. This was before pandemic. And we weren't told. So we'd ring up and say, "Could we have an urgent?" And they're like, "There's no radiologist here." So then, because they're obviously all working from home. And then, so they told us, right, if you just put this new code into this CRIS system, which is ARCU6 urgent, then that will go into this urgent list. Okay, that's fine in practice. But what happened is that you're asking someone to do something different, and that meant them, so before they'd have a sticker, there's something physically in front of them. Now it meant them actually typing into the system the ARCU6 urgent list for them to bring it up. They weren't doing that. They weren't bringing up the urgent list. So the non-urgents were getting done before the urgents. So there was one patient that he had dilated loops of bowel. He could have had a bowel perforation. This guy was really poorly, and it was just before Christmas. And I had been raising these concerns with my manager, saying this code isn't working. The radiologists aren't looking. They're not bringing up the urgent list. The non-urgents are being done around the urgents. Raised it, and my manager told me, she said, "Well, perhaps you're abusing the system." So, and I said, no, combined, all of us were experienced radiographers. We weren't abusing the system at all. So she was just dismissive of everything that I was saying. And there is this culture within radiography that a general radiographers, so I didn't do CT, MR, ultrasound, anything like that. But there's this culture within radiography, this hierarchy, that if you do general radiography, you're seen as less than. And I think when the government changed from this senior 1, senior 2 radiography, and then they went to agenda for change, and they changed this banding to the band 5, band 6, band 7. And so this kind of, people got sort of taken offence that, oh, you're a band 6 and you shouldn't be a band 6 because you only do general radiography. And so what I was saying just wasn't being taken seriously. And one of the other concerns I raised as well, which I think was triggered the manager that had it in for me was, so I did some, like CPD, keeping like you've got to do CP, continuing professional development. Because I worked in the community, I went to the Liverpool Royal in the CT department just to kind of like professional development. And when I was there, there was a patient that was having a scan. He put his head on the sponge. When he got off the scanner, they hadn't put paper roll on the sponge, but there was dried blood on it. There was dried blood on the sponge, and it wasn't from him. It was from another patient. And that was the rate at which they were scanning these patients left no room for infection control. It was just in, out, in, out, and out. And they weren't checking names properly. So they were, it should be an active process when you're asking what's your name, what's your date of birth. They were just saying, what is your name? This is, that's when errors.
They're too busy asking men if they're pregnant, Ruth.
Yeah, exactly. I know, it's bonkers. So I emailed my manager several times saying, I'm concerned about the infection control, but also when they were doing the scan, they were scanning through the lens of the eye. So CT scans are a high dose, and you're supposed to position the head so that you avoid scanning through the lens of the eyes because it's sensitive to radiation. Well, they weren't doing that. So I raised those two concerns. I said, look, I'm concerned about infection control, and I'm concerned about the way that they're scanning through the lens of the eye. She didn't respond to me. And so I then went to the Freedom to Speak Up Guardian thinking, oh, I'm safe.
There was your first mistake, Ruth. There was your first mistake. You went to the Freedom to Speak Up Guardian.
Yeah. And I thought, and I remember even the dad of my son, his parents were saying, we're worried about you because I was obviously really stressed at work and stressed about my son because he was like
they're making you out, Ruth, like you're a nitpicker, like you're deliberately. I can see what they're doing. They're trying to build this kind of, she just goes around like critiquing and moaning about stuff.
Yeah.
None of what you've just said here. We're talking about blood on sponges, radiating the lens, not having a proper checking process, delaying urgent reports, and they're just being missed. These are, near miss events, never events. Some of them, they shouldn't have blood on the back of a bloody sponge. If there's HIV or hepatitis B and C involved, and whose blood was it? No one knows. Like you say, they're in out. So you're not. I don't want anyone to think that this is like somebody that's going out of their way to make snitchy little reports, but like you say, there's this culture around it. So how was your day with the Freedom to Speak Up Guardian?
So his name is
don't mention names, Ruth, don't get in trouble.
So I went to him, and it took him I think it was about 2 or 3 months before they actually did anything about it. But so from when I first contacted him to them sending an outcome was 3 months. And that was I didn't know what was going on. There's very little communication. And what was going on in the background, and I found this out from subject access requests, was that he was saying one thing to me and then saying the opposite behind my back. So they agreed with me. So when they did infection control audits, so after I raised concerns, I never saw them. There was no transparency about it. They just made out that it was all okay.
Bearing in mind, I mean, infection control in hospitals is a massive thing. There's whole teams of matrons and high-level nurses going around checking that you're washing your hands and everything's, squeaky clean. So this is a big business in hospital, isn't it? And to just be sweeping of blood on the back of a piece of equipment under the 3-year process it took, didn't it? So hardly jumping over themselves to correct it.
Yeah, and then they the manager that was in charge of, so they spoke to another manager to do with the scanning through the lens of the eye, and they agreed with me. They said, yes, you're right, you shouldn't, they shouldn't be, so we changed the protocol. So they agreed with me. They said, yeah, that's, we've changed things. And I thought, okay, grand, like, end of. But then not that long after, so that's when my manager told me, she said, she got me in her office and she said, Ruth, you need to stop doing datexes, stop raising concerns. If you do keep raising any more concerns, they're going to do a disciplinary on you. I think that and probably in her mind, she's thinking that she probably thought she was trying to say, look, she's probably thinking that she's trying to protect me, but I took that as a threat, like.
It's highly sinister.
Yeah, so keep your mouth shut or else. That's how it came across.
But disciplinary for what? Raising clinical concerns, safety concerns. Disciplinary for what? It's a veiled threat. There's nothing,
Yeah,
no other
yeah,
interpretation of that from a senior member of staff pulling you and saying, and I've had it in my life, and I know other doctors that have had that. It's this zero tolerance to whistleblowing. I almost say, if you whistleblow, be prepared to pick up your P45 on the way out of the office.
yeah.
And that's this cultural thing in the NHS. And you mentioned radiologists have this hierarchy, this bitchy culture. It goes across the NHS, as doctors and GPs, as hospital doctors that I used to be. And, every department had this weird culture of, there's a big carpet. I talk about this big NHS carpet that everything gets swept under. It's heaving.
Yeah,
It's got so much
yeah,
stuff under it, but there's this culture to cover up. Whereas then they
yeah,
preach that there's got to be this openness, this duty of candor. If you make a mistake, admit it. It's all for the public confidence in the professions. But here we are, having you being threatened. Let's call it what it was. Carry on, you're in trouble. And let's get to that then now, really. So you ended up suspended. If you take us
yeah. I
to
mean,
that point, if you can.
yeah. So those concerns that arose were the end of 2017, and I continued. So I had this veiled threat that and me being me, so I did actually stop doing the datexes for a while because I had to go to, this was now 2018, I had to go to New Zealand. My mum was really unwell with a liver abscess. So I went there, came back, and there was this gap. I stopped doing datexes, but then I kept doing them because there were like major IT outages that was affecting patient care. There was also delays. So one of the datexes that I did was about delays to urgent reports. So there were major backlogs. So thousands, we're talking thousands of.
But
And
again,
I
everything you've just said has got the patient at the centre of the focus of the complaint. It's not like you've got anything to gain from this process that you're going through. In fact, they're a pain in the arse to do, aren't they? As you know, the
yeah,
datexes
they
are
are,
not
yeah,
easy writing, and
yeah,
they're quite pedantic in the level of detail. But you're doing
yeah,
it for your patients, and all risk again and no reward.
yeah. So I did a datex about these delays to urgent reports, and then they got an external company because the backlog was that big. So they got this external company to catch up on this. And then I kept doing the datexes, kept doing them. And then the trigger point was this one that was very, very serious. And this was the one that triggered the disciplinary investigation. And so it was the patient that he had a shoulder replacement. He had goes to Broad Green, has a yearly checkup of his shoulder replacement, and he'd been to Broad Green to see the consultant. I didn't realise at the time, but it was actually specialist physio that he'd seen. And so he had an X-ray of his shoulder, and when you have an X-ray of your shoulder, you catch a little bit of the chest on the X-ray. And so he'd seen the physio, left the X-ray that left the clinic. The X-ray then gets reported by radiologists a week later. The radiologist said, right, your shoulder's okay, but you need a chest X-ray. You need an urgent chest X-ray because there's something on your lungs that we're worried about. You need an urgent chest X-ray. That radiology report did not get read. It did not get actioned until that patient turned up 12 months later. And they weren't open and honest. They didn't do a day text. So he turned up to me at South Liverpool Treatment Centre and said, oh yeah, I've been to Broad Green last week and they told me that I needed a chest X-ray. And I was thinking, well, one, why didn't they just do the chest X-ray when you were there? Why have they made you go to your GP and made more of a, made him have it to do these extra? And so I looked at the X-ray that he had done that week and it hadn't been reported. So I thought, well, how does the patient know that he's to come for an X-ray if that X-ray hasn't been reported? That's when I looked at the previous X-ray of 12 months before. It was that X-ray, that report that said you need an urgent chest X-ray. No one had read it, no one had actioned it. So between the specialist physio and the consultant orthopedic doctor, both of them hadn't actioned it.
Just a simple case. I mean, this is a serious case, a never event of clinical negligence, isn't it? The harm that delay has brought in. It's not been actioned, and a year has passed.
So I did a day text about it, and bam, that's when I get pulled in.
That's the end. Right. That's the end. The end is in sight at this point because you've called the big one.
So you've done. So I done two other day texts. One was about a patient. He didn't know which foot he needed X-ray, and he obviously had some like Alzheimer's or some sort of, his GP hadn't picked up on his memory loss. Was concerned about the clinical care of the patient, done a day text about that. And so I'd done these 3 day texts, bam, get pulled in, right, we're doing a disciplinary into you. And one of them was what I call the prevent patient. So it was a patient that so he came in for an X-ray of his knee. He was a young guy, he was in his early 20s, he was from Sudan, and the GP had written on that query osteoarthritis. Done the X-ray, and he said to me, is it broken? And I said, well, the GP doesn't think that you've broken it. The GP thinks you've got arthritis. So I said, so obviously to break your knee takes a lot of, like trauma. You just don't kind of, it's you've got pretty strong bones in your knee, especially as a young man. So I said, well, how did you injure it? And he said, oh, it was hit by the butt of a gun. So I was like, okay, like, how did you happen to have this gun? And he said, well, do you know what's happening in my country? And I said, yeah. And he said, so I was civilian and I was recruited by rebel forces to fight in the war. And so I just said, well, I'd done my prevent training. I'd done my prevent training with Liverpool Community Health. When we transferred to the Royal, not had any training. And in fact, they didn't even have a prevent policy.
Again, for somebody who's been through prevent, that's a classic case. You've heard about a gun, a civilian rebel unit, and you've got to raise that concern, even if it fizzles out to nothing. It's a bit like safeguarding. I mentioned it before. If it all fizzles out, no one's been harmed. It's dealt with discreetly. And same here, you've got this disclosure of a gun butt damaging someone's knee from a war-torn country. So quite within your rights. Again, for the 20th time during this conversation, you're within your rights to do a day text.
Yeah.
So
So I
disciplinary, what are the charges against you? I mean, what have you done wrong at this point? I'm not.
so the charges about that prevent patient were that I'd upset him. I'd upset him because I'd asked him questions.
And he's just told you he's
Um,
been whacked by a gun.
yeah, so it wasn't he didn't complain. He didn't put any complaint, didn't, he didn't even, because when I know that when you do a safeguarding referral, you have to get their consent. You have to kind of get them on board with what there's, because if you're going to refer them somewhere, you need them to engage in the process. So I was saying to him, are you still involved with these groups? There's this support system. It's called Prevent. It can help you if you're still involved. But he's just clamped down. When I said to him, are you still involved with these groups? He just zipped it. He would not speak anymore, just wouldn't, wouldn't.
Which is a red flag as well. It's another red flag to add. Yeah.
Yeah. And, he'd come through France, Belgium, obviously came on his own. And I just thought, this to me is, potentially there's so I tried to do this, tried to do the referral using their online system, but when we're 2P transferred, the IT systems weren't connected properly. We had to remotely log into the Royal Liverpool's IT systems. They weren't working. So I'd spent days doing this, trying to do this referral. And on these some of these IT systems, when you click on the little arrow, it gives you options for what like, is it child safeguarding? Is it, all the different options? And there was no option for prevent. So I was struggling to do this. So I did a day text because it was about the IT system. And so, and and I know all the Southport stuff that's gone on. He was referred 3 times to prevent. And I know from my experience, when I did my prevent training, we had a video and everything. It's right wing based, it's not. So this is the thing, when you're on the ground and you're faced with the situation right in front of you, you're like, I don't know what to do. I don't know what.
You see with most abuse cases or prevent cases, like you just mentioned, that one example is that you always find that there's always been a trail of previous reports. So there's always previous unaction reports as well. So you're doing your right thing, like the safeguarding, to at that level, just to flag it up. Say, is
Yeah.
just I would have absolutely done exactly the same as you, Ruth, in that circumstance. And so you've ended up in front of this panel. You've been referred to HCPC. Run us through that process. So HCPC is like the equivalent of the GMC. So were you suspended from your role at this point for being a persistent day-tixer?
Yeah, so I did these 3 day ticks, and then I went off sick, and I was referred to occupational therapy, not occupational health. So I went to occupational health first. They referred me to occupational therapy because they were doing the stress risk assessment. So it took them a month to book me an appointment for. So even though I was off sick with stress, it took them a month to book an appointment. And then she called it a stress risk assessment, and then she dictated it, and she lost it. She lost the stress risk assessment. So obviously I wasn't coping at work. I was, I knew that it was game over. I knew that I was going to lose my job. I knew that it was just going to be end game. That was going to be it. I wasn't coping. So it was caught between a rock and a hard place, because I thought, right, if I go off sick, they're going to do me on sickness. If I stay in work, they're just going to do me for my behaviour. And so I persevered and persevered, and my colleagues were then starting to turn on me because they knew what was going on. They knew that I was being targeted. And because I'd raised concerns about the colleague that was drinking, they were just all starting to turn on me. So then it was HR, it was actually HR made the decision, not my manager, it was HR. They took the decision to suspend me. And there's all different reasons for my suspension. So one is that I did too many datex. It was to prevent me doing datexes. One was about my behaviour. So there was all different reasons that they gave. So they suspended me and they didn't tell me how long I'd be suspended for. It was just went on and on.
Was this in person, or did they do the usual NHS trick of sending you a late email? Did they tell you in person?
No, it was in person, and it was really like I found it really insulting because it was in my manager's office. He was an HR advisor, this young guy that had only worked in HR. He'd only just started that role. I think he'd only been in that role for a couple of months. So not even an HR manager. So he came to the York Centre. We went into my manager's office. So it was like a desk. She was sat behind, in front of her desk, and I was sat directly on the other side. He then went and sat in her seat. She moved away from her desk. And then he said, right, I'm suspending you. I'm suspending you for your behaviour. And I just thought, so this is it. I'm getting suspended by, a junior HR. I'm not even getting suspended by my manager. That's it. And that was it. So I walked out. I actually walked out of that meeting, and I went and did a datex.
Brilliant.
And
Do you
then
think you're a datexaholic? Is that what we think? Brilliant.
And that was it. That was my last day, and I'd worked there for like 6-7 years. So I started there in 2013. My last day was at the end of February 2019, and that was it. So and then I had this suspension that went on and on and on and on and on. And then I contacted the HCPC because I was starting to worry. I thought, I'm being suspended. Like, what's, what? I didn't know what the deal was. So I contacted the HCPC, couldn't get through to them on the phone. So I sent them an email saying, this is the situation. I've not had a disciplinary hearing. I've not had a disciplinary, I hadn't actually had a disciplinary hearing. I hadn't had any warnings. I'd just been suspended. And so the HCPC, instead of ringing me and finding out more information, they just put it through as a referral for fitness to practice. And I was just thought, oh no, this is, I knew it was just once. It's like this, the NHS and the HCPC are this big, ginormous kind of machines that once you cranked it up, you can't stop it. That's and so then this referral had gone through, and then I resigned. This was in the January of 2020, so it was before the lockdown.
Your suspension had run then about 12 months. Is that right? And then you resigned after 12 months. And then in the background, that had triggered HCPC referral, which is like the GMC fitness to practice.
Yeah, so because I'd contacted them, they, instead of kind of ringing me, finding out more information about what had happened, they just triggered it. They just triggered it as fitness to practice. And then I actually I'd met a guy on Twitter who his dad had died in the Royal Liverpool Hospital. Appalling care. They'd hoisted him, broke his dad's toe when they'd hoisted him. He had pressure ulcers from being in the hospital. He says that the NHS murdered his dad. He actually, when his dad died, he actually ran into the nurses' station, grabbed the phone and said, "I'm calling the police. You've murdered my dad." And I met him on Twitter, and we went to the trust board meeting. We actually went to the trust board meeting. Jamie had printed out photos of his dad's pressure ulcers, and we just went in there. We ambushed this trust board meeting, and I called them out. I actually said, you target people, you bully staff and harass staff for completing day taxes, and the deputy HR manager, when she got wind of that, she actually rang and contacted the HCPC and said she's been to a trust board meeting. She's been told about her behaviour. And so they actually included that. They couldn't put that on record. They couldn't say, "Oh, she's been to..." So that was never part of the charges. So the charges were just, they were saying that I was aggressive in a meeting that I wasn't actually. So they got the date wrong. They were saying that I was aggressive in a meeting that I wasn't even at. So it was
playbook, isn't it? It's the over exaggeration. I've had those sorts of things said before. I was querying why, for example, four female members of staff had masks on and they were working from home in their offices with masks, and I gave them electron masks, and I get a call from the chief medical officer the next day saying you were aggressive and you made these 3 female members of staff feel intimidated because I basically said, "Why the bleeding hell are you wearing a stupid mask at home in an office on your own?" And he's giving me the old mental health gaslighting, but this is a playbook that they use. It's misdirection. I've got that with the GMC at the moment. They're deliberately twisting and misdirecting and misrepresenting, and it seems to be a playbook that goes across the NHS machine, across the HCPC, midwifery council, as well as the GMC. There's this playbook that they stick to, almost scripted, and once you get that target on the back of your head, as you have and I have, for daring to whistleblow, daring to question on the face of patient safety concerns, then zero tolerance. No.
Yeah.
And they make your life now. So this process has lasted, HCPC, run us through that. It's been a long time.
So it took four and a half years from start to finish.
4.5 years.
And there was, ended up no case to answer. During part of that process, they referred me to a forensic psychiatrist.
See what they do? I've just had my letter from GMC asking for a psychiatric referral. So this is what they do.
So, and I was, as you can imagine, I was completely spinning out. I was just thought, I am open about my mental health. I suffered terribly with anxiety, depression. I was perimenopausal. I didn't know that I was having my symptoms. It wasn't until Davina McCall came out with her programs in whenever it was 2022 or whatever, that I knew what was happening. I didn't know, I had anxiety, depression, and OCD. I was, driving halfway to work, then turning around and driving back because I thought I'd left the iron on, and then late to work, and then I'm worrying about that, and then my son's started high school and all the worry about that, and so so obviously I had this that arranged this forensic psychiatric assessment. I'm completely spinning out, and they do this thing where they ask you leading questions. So he asked me if I intended So at this point, when they did the assessment, I was doing a work from home job, it was work for the Home Office. And I was quite happy at that point doing that. And he asked me, the psychiatrist, forensic psychologist, psychiatrist, if I intended to go back to radiography. And I felt that I had to say no, that I wouldn't. Because, I mean, at that point, I sort of was unsure, but I just felt that I had to say that I wouldn't go back to radiography. So I said to him, "Oh no, I probably won't." I don't think that a forensic psychiatrist should be asking those questions anyway. They are tasked with assessing what they think, not whether whether I'll be going back to radiography. I think that they HCPC had specifically asked them to ask me that question. So when he'd
Part
done
of their
his
exit strategy, isn't it, to get you out? They're going to gaslight you. They're going to break you spiritually, mentally, financially, reputationally. This is the playbook. And then they're going to gaslight you that you're psychiatrically unwell. And let's face it, between both of us and our stories, there's going to be some reactive anxiety, reactive stress, reactive depression here, because we're just doing our job. And yet you're put through the ringer. Your story is making me so angry. I'm really holding my anger in to sort of, because this playbook, and it's used on all of my colleagues, the COVID dissenters. You've done patient-centered dataxes. I've made concerns about children, pregnant women, ethics and evidence-based concerns, and look at us all. We're the ones that work, and look at the culture in the NHS that silences us. It's just sick. And 4.5-year process, Ruth. Anyone who can say that's humane in any way, shape or form is ill. They need forensic psychiatric assessment. But how's it ended? I mean, has it finished now? It's done. I mean, what was the process in the 4 years in a sort of sentence, really? Was it just like meeting after meeting, or was it disjointed communication?
So it ended up being that they referred my case back. I mean, this could be a whole new podcast, but they referred it back to the investigations committee, and they decided there was no case to answer. So 4.5 years, and they said no case to answer.
Did you get an apology?
No, nothing.
Did you get any safe, like, apart from the gaslighting that you were mentally unwell, did you get any check-ins? I know there's a quite concerning, statistic about doctors under investigation and suicidality, but no check on your health.
Nothing. So that forensics psychiatrist, I mean, he was kind of he couldn't say, because I was open and honest about my mental health, and had sought help for my mental health. He couldn't really say anything. All he could say really was that I had an anxiety and depression, and I'd also had treatment for post-traumatic stress disorder. When I worked at the Children's Hospital in the early 2000s, and there was something that happened there that was very, very traumatizing. And so that's all that he could really say in his forensic report, is that's all that he could say. And so so the HCPC then said to me, if you come off the register, we'll drop this case against you. So I just said, no, you can do one, because at that point I'd sort of thought, well, why should I? Why should I? No, I want to clear my name. And I did clear my name. And so they did. So they do this thing where, so they've got these allegations, and then I started challenging the allegations, because so the HCPC themselves are corrupt. The case manager, I submitted a whole load of documents. I submitted my defense statement saying this is my explanation, what happened. She didn't put it in. What she did is she drew up this case for her version. She basically slagged me off. She called me gone rogue. And then
sorry to stop, but that's exactly what they did. Gone rogue.
And then she slags me off. Then this document that I'd written, my defense, my explanation of these allegations, she didn't put it in. She put it in the index. So she put it in there. She made reference to it. So she said in her statement, so she took snippets out of it. She didn't put it in. She did not put the whole thing
This is
in.
supposed to be neutral. This is supposed to be an investigation with no impartiality. And again, going back to the GMC, I've been told no witnesses are allowed. It's making differential decisions. I mean, apparently the Human Rights Act doesn't apply during a GMC hearing. I'm not allowed to even use most of my own witness statements. I'm not allowed to reference third parties that will contribute to my own explanation of why these charges have been brought against me. And you're completely silenced. And it sounds like here again, the HCPC have been completely partial and have took a decision completely unprofessional, editing your own words, like I'm not allowed to use my own witness statement or massive chunks of the annexes of 2,000 pages of rebuttal. I'm not allowed to use most of it, they've told me. And same thing here, you've had that treatment where they've judged you, they've called you a rebel or what's it, gone rogue, and just fully judged you. How did you rip off the hook then? How did you manage to, is it just a case of they just spun it out and spun it out and spun it out, and at the end?
So I then picked apart. So the devil is in the detail. So I picked apart their allegations saying, well, the patient didn't complain. You've got no evidence. There's no evidence for this allegation. I wasn't at that meeting. And then, so I was submitting all my health records saying I was ill, I was ill, I was ill when you're saying that these things happened. I wasn't in work when you're saying that these things happened. And so, because the case manager, so the trust argument was that I didn't engage with occupational health. They're saying I was just completely out of control. I was just crazy woman that was just going around doing day texts, wasn't engaging with occupational health, and I was just all over the show. No, that wasn't the case at all. Is that I was engaging with occupational health. They weren't doing what they weren't doing their job. They've been told to act on the stress risk assessment. They hadn't. They caused my mental health to have a massive, massive deterioration. And so, but the HCPC, because they weren't listening to me, they were listening to these people in authority. The deputy director of HR was saying these things. So therefore, it must be true. It must be true. And so what they did was they created a narrative. So she took out my occupational health visits. She excluded all of that. She didn't include it. She didn't include my statement that I typed up. She didn't include all the whistleblowing. She said that my whistleblowing was a complaint. And so they just completely changed the narrative. And so I just persisted and persisted and persisted. And I just had, where they'd written statements, so where all these staff had written, there was like 5 or 6 people from the trust where they'd written these statements, and I went through it line by line. It took me about 3 months of just working like 7 days or 7 hours like every day, and I picked through it line by line by line where they'd lied. And there was, there's always one person, there's always a couple of people in the NHS that they know that they're on your side. So I'd been doing all these subject access requests, and I managed to do a subject access request to Merseycare. So for some weird reason, Liverpool Community Health emails were linked to Merseycare, and when it was pulled apart, some of it went to the Royal, and then some of it went to Merseycare. So I'd done my subject access, and I managed to get these emails that they were between my manager and the HR guy, and it completely unraveled their whole argument. And that also, so all the concerns that I raised as well, what they'd done is they'd paid this guy to do a report, a review of all my day texts. There was something like 23. There weren't hundreds. They were just, I wasn't told about this review, this, until it was sent to me on a subject access request. It shouldn't have really been sent to me because my initials weren't on it. My name wasn't on it. I know that they were my day texts. I know they were because I recognized them.
But again, you should be part of that. I mean, I found out recently from a similar subject access request, a number of sheer complaints, baseless complaints. There's been meetings happening in my locality behind my back. If there's a meeting about me, maybe I should know about it and be able to defend myself. Same here. You've luckily come across this exchange of emails. I've had 3 people who have shone a light of positivity from the GMC in my whole 3 years. They've all gone missing in action. 3 people along the way that have offered me support. Most recently, a young guy who's just joined the GMC told me that this was entrapment, that it's not valid, they can't contact the complainant, so we can't see how we can move forward with this because it's just an anonymous troll online. And he's gone missing in action. He was giving me weekly calls, see how I was. Really nice relationship with him, and gone, disappeared in action. And this happened twice. So, there's this, once you've got this target on your back, it's relentless. Ruth, how are you now? I mean, I'm feeling your trauma. It's actually triggering me a lot because of the similarity in cases. I mean, I'm only 3 years in, you're 4.5 years in with the HC. Have you reached that acceptance now that you've just worked for an evil entity and you're better off out? Are you at peace?
I think since coming off the register, it certainly feels like a weight lifted off me. I mean, it's because I've been through it before. I kind of know. I knew what they were doing. I knew what they were doing before they'd even done it. So it was kind of like, what's happening, and it's kind of like, I don't know if you've ever been caught. Like when I was in New Zealand, so I kind of bodyboard and I got caught like in a, knocked underneath the water, fell off the bodyboard and knocked. And it's kind of like you're being spun in the water in slow motion. And it's like, what's happening, but you're powerless to stop it. And that's kind of what happened. You just have to kind of, I guess do what you can do. But it's kind of like this big NHS machine. It just clunks along until it ends. And I mean, the things that have got me through are obviously my dog and my son and art therapy.
Can we meet your dog? I know we've seen bits of your dog's backside, but do you want to bring your dog on? Can we introduce?
He's just asleep. There he is.
This is your mate. Is that a Chocky Lab?
They said that he was a what do you call it? A sheepdog. A border collie, but he doesn't act like one. So I did a DNA test on him, and he's half a Springer Spaniel, quarter Husky and quarter German Shepherd.
Wow, we've got Shepsky, we've got Shepherd Husky cross, and they're good fun. Yeah. In fact, you probably heard him barking at the postman during the interview, but it's really good to see a smile at the end of this, because it's been harrowing to hear the story, Ruth. Not only, I mean, we focused in the second half on this treatment by the, of zero tolerance to whistleblowers, treated like a criminal, put through the ring, and at the end of it, you've had to give up the fight. I've had to give up the fight myself with the GMC, but also your physical health. You took a jab for the right reasons, in your own mind, and you were told, do this for your family, protect your mom and dad over in New Zealand, and you can't travel without it. You do the right thing, and then your health is going to be permanently affected. So, Ruth, hats off to you for your courage. Hats off for speaking out. I really do appreciate the time you spent going through what must be triggering to talk about. Any final thoughts that you want to sort of say to the viewers about, if you're let's say if you were thinking about whistleblowing in the NHS, what would you encourage them? Would you say avoid like the plague, or somewhere in between?
This is, I don't know. I don't think there's an answer. I think it's really is to do with, I think, building strong relationships. I think that you have to feel safe in the relationship with your manager, but also the way that the NHS works is that managers are just so remote. So the manager above your manager and above that manager, you just don't have a chance to build a relationship with
And
them.
often
And
not
so,
clinical as well, often not clinical.
yeah, and so things get taken the wrong way on email. That I think the email is the cause of a lot of arguments and taking things the wrong way. And I think if anyone was going to raise concerns, then make sure that that you do it with somebody. But it's just the freedom to speak up, Guardian. They're just I completely got thrown underneath the bus by the freedom to speak up Guardian. He was saying, he was actually agreeing with HR, saying, oh yes, she needs to be investigated for her interactions with the patient. Well, but
Well, they should change the whole thing to freedom to speak up, but don't. Guardian.
Yeah, so it's I don't know. I don't know what their answer is. To me, my only answer is that the government have a hospital that only has whistleblowers in it, because do you know what? It would be the most safest, the most cost effective. It would be an outstanding, like, so efficient hospital. And to me, I think that's what you need to take the best out of from whistleblowers, and see what, because we genuinely do, we want the best for people, and instead we're demonized. It's
Well, it all comes under clinical governance, doesn't it? All of this, whether it's infection control, patient safety, data, and you look at the track record of whistleblowers, we've touched on it many times here, it's just not tolerated. There is a culture within the NHS, we've discussed that at length, but there's also an acknowledgement. Most of these interviews that I'm doing are from people that have left. There's no one, in fact, I've had one this morning that's cancelled because they're in fear, genuine fear. I've had people contact me all the time saying how they're scared. How can we have an open culture and a duty of candor when people are petrified? Because I'll tell you now, if these systems didn't exist that were deterrent to speaking out, the COVID thing would have been over. The jabs would have been stopped 3 years ago. We had 100,000 doctors at the beginning and nurses saying no to the vaccine. Where have they all gone? Where have they gone?
Yeah.
But with safety in numbers you've just said it, go in pairs, work together, document. That would be my advice, and be prepared for a prolonged experience of pain.
And the other, I've been following the Lucy Letby case, and as soon as she was convicted in 2023, I knew that she was innocent. I believe that she's innocent. She completed datexes. So she completed datexes about stuff being missing off the emergency trolley. She completed datexes about babies dying. I knew
There's a trend here, isn't there? There's a trend.
Yeah, the way that I've been treated, I knew that, and it's bullying doesn't do it justice, because it's mobbing. It's mobbing. The whole organization just take you down. And I wrote wrote down all the people that were involved that I had contact with in my case, and it was something like 67 people, and not one of them thought, hang on a minute, like maybe she's right. Maybe these concerns that she's raised are actually, maybe we should do something about this. Not one of them is, it's called the bystander effect, where everyone else just thinks that someone else is going to do something. And I think that's what's happened with Lucy Letby, but people haven't spoken up. And the thing is that the managers that were involved with taking me down, guess where they work now? Guess where some of those managers work?
Probably right at the top somewhere.
At the County Chester Hospital. So one of the managers that was involved with getting rid of me is currently the Chief Operating Officer at the County Chester Hospital. The HR manager that was involved with getting rid of me in Liverpool She went to work at the Countess of Chester Hospital just recently, so just would have been involved with the Thirlwell inquiry. So I know that those people, what they did to me, they would be involved with withholding evidence for the Thirlwell inquiry with Lucy Leckley.
Like you said, people go right to the top, and there seems to be that culture, doesn't there? That if you keep your head down and shrug your shoulders. In fact, I was told that by my appraiser a few years ago about the whole speaking out in COVID. He said, "I appreciate your bravery, but what you should have really done is kept your head down and shrug your shoulders." That haunts me because it sums up the whole culture. It's a bullying culture, but more than that, as you mentioned, it's a mob bullying. A lot of my trolls, stalkers, are medical. I've identified several of them. They're all medical, senior doctors, Freemasons, etc. And there's just this culture. No one checks in on you, Ruth. You've not been checked in on. I've not been checked in on. The reason for my adjournment of my case is a mental health crisis myself. It pushed me to the limit till I broke. I've not heard from the GMC since. I've not heard from my GP. I've not heard from anyone. There's no active outreach. You know, when there's a man down or a woman down like you know, has anyone stepped back ever and thought that must have been really shit for Ruth to go through that? How's Sam White doing now, because he's been shit upon from a great height by the GMC and how's he doing? There's no outreach. And then they query when, you know, doctors are topping themselves or nurses already, having gone through this torturous and deliberately torturous process.
And I remember saying that to the HCPC because I put a complaint in about, you know, the fact that they've done this forensic psychiatrist report. And I did put in a complaint about that. And I said to her, you didn't even need to do a hearing on me. You didn't need to have a final hearing. You did, because it obviously got referred back to the investigations committee and then they just threw it out. And I said to her, you didn't even need to have a hearing. And because they knew, and she laughed. She actually laughed. She'd say to her on the phone, don't laugh because it's not funny. You know, so they knew that the process was the punishment. They knew what they were doing. And like you say, I had no support. They did bring in this company called, I think, Empower or something like that, where they were, because it started supporting, so the victim, shouldn't say that, the patients had complained about if the patients were harmed or whatever. So they were, HCPC were supporting them, but not supporting, you know, registrants. And the only reason that I found out about this support that they eventually brought in was that she tagged on the bottom of an email. And I only found that out because I happened to scroll to the very bottom of her email and she tagged it on the bottom. She didn't openly and actively say to me, Ruth, we know that you're really suffering, you know, through this process. Here's this organisation that can help you. I just happened to find out.
There's a footnote to most emails from the GMC I get that I've got basically Samaritan's number and the crisis team tagged at the bottom, so they can tick that box off. But I mean, from the chat with you, it sounds like the GMC and HCPC are two cheeks of the same arse, let's say, for want of a better phrase. And Ruth, thanks ever so much for bearing all today. I really appreciate your time. Thank you for your courage and bravery. You've left it all on the pitch, which is a footballing phrase. You know, I was a captain of a football team. If you didn't leave the football pitch, leaving everything out there, you've done that in the last 90 minutes, funnily enough. So thank you ever so much. I know that this is going to have big impact on the viewers, and you know, this story can be multiplied over and over and over again to all of those that fell before us, let's say. It is a war, so a war analogy is a good way to end. So thank you, Ruth, and appreciate your time, and stay in touch.
Thanks very much, David. Thanks for giving me the chance to talk.
All right, you take care. Bye.
Okay, thanks a lot. See you.